no one ever gets taught how to understand health insurance or how to use health insurance. And it's not until you're in this traumatic situation of trying to figure out what's going on with your health that suddenly it's a crash course. So to your question about what should young adults be thinking about with respect to health insurance, I think it starts at the basics.
One thing, in my case, I initially had Kaiser insurance. And when I was initially diagnosed, again, because I was an otherwise normal, healthy 30-year-old woman, and they didn't suspect that I had cancer. So they thought I might have had asthma. They thought it might have been a UTI. So going back and forth with several hospitals in the DC area, I went to Georgetown, I went to Doctors Community Hospital. No one could really figure out what was going on. So finally, when I went back to my doctor at Kaiser, I passed out in the waiting room, and that's when they brought me to a different hospital. And the doctor there said, I'm not going to let you leave until we figure out what's going on with you. So they finally diagnosed me 8 months later. And at that point, I was in stage 4. And I felt that I knew during the times that I kept going back and forth to these different hospitals and to these different doctors, I knew something was wrong. So I think one of the biggest things is to be aware of your body and to advocate for yourself, no matter how hard, people are trying to convince you that you're okay. So I ended up switching my insurance to Care First. So I wanted to ask you, what do you think, as far as, insurance, what do you think some questions that, some young adults could have to insurance companies to make sure that they advocate for themselves?
So I really appreciate you sharing that. And I think you are absolutely correct in that people have to be their own self-advocate. Nobody knows your body better than you. And that can be really challenging in our healthcare system, especially because you're restrained by insurance companies and networks and all of these things. And what we typically find in our work at Triage Cancer is that no one ever gets taught how to understand health insurance or how to use health insurance. And it's not until you're in this traumatic situation of trying to figure out what's going on with your health that suddenly it's a crash course. So to your question about what should young adults be thinking about with respect to health insurance, I think it starts at the basics. So understanding the terms that are being used in the policy. So things like what's a deductible and what's a premium and what's a out-of-pocket maximum and what's a network and why do I care? We often say that this should be taught in high school. People shouldn't be able to graduate high school without a course in health insurance and a course in finances, because inevitably at some point in our lives, we're gonna have to be able to figure this out. And so we have a lot of resources at Triage to try to teach people about health insurance. But it's also about understanding how to pick a plan.
Okay, so speaking a little bit about different insurance plans, can you tell us the difference between like HMOs, PPOs, in-network versus out-of-network?
It's the alphabet soup of health insurance, right? Like, what do all of these things mean? So there are two kind of payment models in America. So there's a fee for service where somebody goes to a provider, pays a fee to get healthcare. And then there's what's called a managed care model. And that's where care is sort of bundled in an umbrella. But when we talk about managed care, there are a couple of different options. And you mentioned HMOs and PPOs. So like, what does that mean? Well, HMOs, also known as health maintenance organizations, are where there's a small network of providers who have agreed to be part of this HMO. And then people who have this HMO start all of their care with their primary care physician. So you were saying, I wasn't feeling good. You would start with your primary care physician. And then if that primary care physician couldn't figure out what was going on or provide the necessary services, they would refer you out to a specialist. The challenge with that, though, is that again, you're always starting with that primary care physician. So if you have a complicated health situation, that might become really sort of burdensome and overwhelming. But on average, HMOs tend to be less expensive. With a PPO, it's also known as a preferred provider organization. And that's where there's a larger network of providers. It might be across different hospital systems. You mentioned that you went to several different hospitals in the area. It's helpful in that case then to have a PPO because they will allow you to go to different providers. You don't have to start with that primary care physician. You can go straight to the specialist. So there's more choice and there's more flexibility. In exchange, you're going to pay a little bit more. So people often say like, well, which is better? And the honest answer is it depends. There's no one size fits all here. It depends on what is available to you in your area because every state has different options. And then it also depends on your needs. So if somebody has a complicated health situation and they're seeing many, many specialists, maybe an HMO isn't the best option. If they're relatively healthy and, you know, only really go to their annual checkup once a year, maybe an HMO is a great option for them. So it's tough because there's no one option that I would recommend.
Okay.